Hi everybody and welcome back to the EASL Talk Liver to Me podcast. Today's episode is all about MetALD and more importantly whether this new terminology actually changes how we treat our patients. So MetALD sits at this intersection of metabolic dysfunction and alcohol use, and it's an overlap that we all are familiar with in everyday clinic, but it's a new entity and the field is still kind of grappling with how we tackle it. And as a result, this leaves space for uncertainty and a bit of space for controversy. And with all of that in mind, we've very deliberately invited two people who we knew would make this a genuinely interesting and engaging conversation. So we have Rinella, who's the Professor of Medicine at the University of Chicago, and Aleksander Krag, who's Professor in the Department of Clinical Medicine at the University of Southern Denmark. They're both fantastic communicators and major opinion leaders in this space, and they both see loads of SLD patients. And excitingly for this podcast, they don't always see eye to eye on everything. Some things, but not everything. And so I think this will make a really engaging and entertaining listen. I'm not entirely sure how this is going to pan out, but I want to try and help us cover 5 key areas. Number 1, how do we define and diagnose MetALD? Number 2, how does it behave? What's the natural history? Number 3, do we know anything about underlying pathogenic mechanisms? Number 4, how does all of this influence how we practice in clinic? And lastly, number 5, looking forward over the next 5 to 10 years, how will this MetALD terminology influence trials and treatment? And so with all of that in mind, let's get stuck in.